Okay, so hello everyone. For this week's pod, we're going to talk about the biggest trends in aesthetic medicine right now. Um, Now, if you look at aesthetics and the narrative that's being built around it, I think I'm right if I say that it's really shifted. A few years ago, I think it was all about lips and cheeks, and there was a lot of articles about filler. Was it too much? Was it not enough? And I think we were seeing, I think at one point that they were calling it like having a pillow face. Now, we've seen a real move away from that. And I think a lot of that is because actually the aesthetics have improved and actually the treatments have improved. And it feels like the focus now is really on skin quality and regeneration. And I know that when you look at it's certainly in the world of sort of skin creams, people are talking much more about protecting the skin dermis and about long-term skin gains. So from what I'm hearing from dermatologists and clinics is that the conversation has really changed. Do you agree, Ravi, that is a lot of it is because the aesthetics have got better?
Yes and no, Amber. Okay. Yes and no. I think that previously, when people first looked at aesthetic treatments for themselves, they wanted dramatic changes. Because it was an investment. It was expensive for them, and they wanted to see a sudden change. And therefore, they demanded the treatments that produced those, such as anti-wrinkle treatments, such as botulinum toxins, such as fillers that would create contour changes, and they wanted obvious contour changes as well. If you did a subtle contour change, they'd be unhappy and want more. It's all
Ah,
about getting value for your money, what they perceived. Now, that was at the detriment of their aesthetic, their balance, their beauty, but some people wanted to wear a badge of honor to show people they could afford aesthetic treatments.
I've never looked at it like that. So,
Back then, back then, we were desperate to try to get people onto skin care and improve their skin hydration, their skin quality, because an old face with sun damage and wrinkles on the surface still looks old if it's not frowning, still looks old if it's got big cheeks, and still looks old if it's got inappropriately big lips. Okay, whereas if you improve the quality of the skin, that's what dermatologists and cosmetic physicians have been trying to get along to patients for ages. So now, thankfully, the trend going around socials now is that they revolve around four main areas. Skin quality, thank God. And how do we get that? We stimulate collagen with regenerative medicine techniques, and also we can have some non-surgical lifting techniques. So what we're trying to get here is that patients are becoming increasingly cautious about looking done, and they want to be and have a natural look with healthy looking skin. And thankfully, that's the current trend.
okay. And so within that sort of realm of skin quality, what are the main treatments that people can look to have?
So what's trending at the moment are polynucleotides, and I'm sure you've heard a lot about those.
Yeah.
Skin boosters, which have been around for at least 20 years. RF microneedling, which is an evolution of the microneedling technology, and laser skin resurfacing, which has been around for many years. It's become safer, less recovery time, and there are now various techniques and modifications to the laser technologies to be able to customize the downtime and effects according to someone's social and lifestyle and risks.
So instead of altering the face, these treatments are looking at improving the skin on top of it effectively.
Exactly. I mean, these treatments, they improve the condition of the skin itself. They target pores, texture, crepiness, and dull skin. And the goal is a natural improvement rather than massive change. It's about improving the canvas rather than repainting the whole picture.
Yeah. And I guess the results aren't as dramatic and people have got to be prepared to invest some time and to wait for the results.
Absolutely. I mean, again, I see in clinic patients saying, when will I see results? And I go, well, when do you want to see results? We can do straight away, or we can do over the next few months. Oh, no, not suddenly. I don't want anyone to notice. Okay.
Okay.
And that's what they see. They want people to think they're healthier looking, and they just want to look very healthy for their age. And
Yeah.
that's, the 40 pluses, I would say.
Okay. So another phrase that keeps coming up is collagen stimulation. and something called collagen banking. Um, what does it actually mean?
Collagen banking is an interesting term because it stems on the fact that after about the mid-20s, you tend to lose 1% of your collagen every single year. So by the
Oof.
time you're about 50, you've lost about 25 to 30% of your collagen since you were 25. So collagen banking is a term where we use collagen stimulators in younger patients to slow down that patient, put in some deposits of collagen into their skin so that the natural deterioration is starting from a higher place. We're trying to kind of like keep filling the pot. So treatments that do that, and they're really trending at the moment, are collagen stimulators like Sculptra, Radiesse, Elance, radiofrequency microneedling, and of course laser skin resurfacing.
How early can you start with that then? If your collagen actually starts depleting in your 20s, and of course that just accelerates as you get older, when should you start with these?
Oh, you can start. If you've noticed a deterioration in your skin quality, that's typically after 25 years old. At that age, you then need to see an experienced clinician who would advise the most appropriate form of collagen banking for you, for that skin. It
Mm,
might be simple microneedling. There's no energy, there's no product, there's no risk of contour deformity, there's no risk of burns, and there's no risk of foreign body reactions. So very safe and maybe quite appropriate for someone of that age. However, if they've got acne scars, significant acne scars from earlier acne, and they want collagen banking, then I'd be going on to something like radiofrequency microneedling at first,
yeah,
or perhaps, laser skin resurfacing. It all depends on their skin type and the activity of their acne. So yes, you can start relatively young. As you get into about 30s, you might be thinking of collagen banking. You could use something like Sculptra, which will treat the whole of the face,
yeah.
pretty much the whole of the face, and really does create the most amount of collagen per buck. Okay, that
And
you do.
it's really subtle. That's a treatment I know you can have, and no one is going to actually think that you've had something done.
No, unless they overdo it. And, obviously you need to go somewhere good because Sculptra has risks. And that is usually down to injecting
Mm.
technique and poor aftercare. So, but Sculptra improves the radiance, the glow, the density of the skin through increased collagen, increasing the extracellular matrix, and improving the tiny capillaries, the blood supply that go towards the skin. So what do you have? You have a healthier skin.
Yeah, and actually quite good for people dealing with weight loss as well, which obviously is a topic that's quite current at the moment.
Yes, exactly. We're seeing with some of these weight loss drugs that they have, there may be some evidence to suggest that these weight loss drugs actually target the regenerative fat cells in the skin, not below the skin, within the skin. They're called the DWAP layer, dermal white adipose tissue. And there's been some evidence to suggest that this layer is depleted, and treatments like Sculptra have been shown to reverse that.
Yeah. So actually, that sounds quite, yeah, again, a subtle procedure that you can have and something that you can sort of, it sounds like more of a long-term investment.
When someone's investing in their skin and their skincare, it's a long journey. It's a marathon. This is okay. We're not quick fixes can happen, but the longer lasting skin health treatments like collagen banking, Sculptra, laser skin resurfacing, microneedling, they are all about long health improvements to your skin. The quick fixes now would be perhaps treatments like Botox, treatments like dermal fillers, and perhaps treatments like a hydrofacial, for example. They'd be
Yeah.
quick fix treatments, lastminute.com jobs,
Well, we do all like those occasionally. Now, the area that really fascinates me, and I've been reading a lot about, is and I can never even say it, can I? Exosomes, which is PRP, and it falls under the umbrella of regenerative medicine. Can you explain it to me?
So let me help you with that.
Yeah.
Exosomes, PRP, which fall under the umbrella of regenerative medicine. So what does that mean? Well, why are they trending? They're trending because they actually look good when applied on socials. It's usually lots of little blebs on a skin. You look like some armadillo or something, and it looks very visual. The effects of these treatments are subtle. Okay, so I would say that in order of clinical science that backs these treatments, I would say that you've got PRP, and PRF that has been around for many years, and it's been shown to help wound healing and increase tissue healing responses. So in other words, produce new skin, new collagen via its own growth factors.
And they both work the same.
It's very
PRP and
similar. There's
PRF.
just a slight difference in the way they spin, but essentially what happens is you take a blood sample, you spin it in a centrifuge, you separate growth factors, and the difference between the two is which growth factors you separate and how long you spin for, and then you use one more as a volumizer and one more as a skin rejuvenator, a skin booster. So that's PRP and PRF. Okay.
Yeah.
Now, polynucleotides, I'm going to put below that. That's got some evidence, probably about 10 years of evidence in animal studies and some recent human studies to show that there is a very mild amount of collagen stimulation. But what they do, they tend to improve the quality of skin as opposed to the density of the skin. Okay, so they're good in areas where the skin is incredibly thin or incredibly crepey, such as under the eyelids or on sunburned cheeks, for example, or necks. Then they derive from salmon DNA, and that's been shown to create an environment which stimulates fibroblasts to produce healthier skin cells.
Yeah, I've seen a lot of that on social media. That's definitely a big one that's trending.
Now, finally, you mentioned the exosomes.
Yeah.
This is a case where marketing is really way ahead of some solid clinical evidence. Okay. So they are being marketed as the next best thing to, anti-aging, the holy grail. What exosomes are, essentially they are they improve the transmission between cells. So the signaling between cells, and in all cell processes in our body, cells have to talk to each other. So when we're talking about skin quality, we need all the cells that are involved in growth, cell repair, cell regeneration to talk to each other better, to communicate better. And exosomes enhance that communication. That's what they do. Now, they are derived from plants or humans. Now, in the UK, human-derived exosomes are not allowed. They haven't been approved. Okay, whereas plant-derived exosomes are allowed. So we have those in this country. The best way to apply them is via microneedling, and then you wipe the exosomes over those tiny little microchannels that have been created, and the exosomes sink into the holes in the skin, and then they work at a deeper level in the skin. That's how exosomes have been shown to work best. But
Okay.
as I said, more marketing than solid evidence at the moment.
So it could be a little bit that there's a bit more excitement than the science is actually proving.
It could be a case of watch this space, really.
Yeah.
We're just so early, so
Yeah.
early in that area.
Okay. And then non-surgical lifting. I hear this one a lot as well. Now, previously, a non-surgical facelift was always about injectables and fillers, but that's not the case anymore now, is it?
No, I think it's now needs to be referred to a non-invasive form of lifting, So what we mean here is something that doesn't break the skin. There's no needling into the skin whatsoever. And these treatments, which are trending, are energy-based devices such as M-Face, Softwave, Thermage, and Ultherapy. And let me go through those. First of all, Ultherapy, I'll start from the bottom. Ultherapy is the original form of HIFU, or high intensity focused, and they called it micro-focused ultrasound.
Yeah. And actually, that's been around for a while and has been proven to be effective.
It's been proven to be effective in the right patient and in the incredibly skilled hands.
Yes.
Because what you have to do with it, you have to ultrasound scan the face and then look out for a 1 millimeter thin layer that's about 2 to 3 millimeters below the skin and target that. You have to have that in the target zone on the scan. Now, it's hard enough for a clinician who's not done ultrasound scans before to get that right all the time, let alone estheticians or beauty therapists, okay, who have never had that training to that extent and that precision to that extent, and understanding what a grey screen of cloudy, mottled images. Imagine looking at an ultrasound on a baby scan. Okay, it's obvious you see your baby, but what about all the bits around it, the placenta and all that? We have to 1 millimeter, you have to make sure you get it right with with our therapy. So that's why the results of our therapy are very inconsistent among clinics and practitioners.
Okay.
Um, but when it works very well. So I do recommend going to a clinic that has extremely good success with it.
Mm.
Okay. Um, the Mars is similar. The Mars uses deep monopolar radiofrequency energy and heats the deep tissue to contract the collagen. So if you imagine when you heat skin or heat something plasticky, it shrinks. It's doing that at a deeper level, and therefore you get tighter skin, deeper, tighter skin, and therefore that produces a lift. Soft wave is a gentler form of ultrasound that does a similar job to our therapy, but not as painful. That's new. The evidence is still emerging, and the marketing again is ahead of the game there. And then finally, M-Face, which is a relatively new technology. It uses electromagnetic waves to micro contract your muscles. So it's almost like doing facial yoga, facial exercises. And what that does, that stimulates those muscles to become a bit thicker, a bit more active. And therefore, it works on the premise that your muscles are becoming relaxed as you age. So if you tighten those muscles, you get some lifting. Again, that's part of the reason your face starts to drop. It's not the only reason, but it's one of those parts. I think the good thing about M-Face is that it doesn't hurt. It feels like a tingling sensation, like a TENS machine sensation, and there's no downtime with it.
So, despite the fact they're non-surgical lifting, that's the umbrella they come under, they're not a substitute for surgery.
None of these are a substitute for surgery, but some of them may help surgery, and some of them may get in the way of surgery, and some of them may help surgery afterwards. So surgery is not great at treating skin. It's great
No.
at pulling the structures underneath. Absolutely. But you still need to address your skin. And that's where non-surgical aesthetics, all of these aesthetic treatments really help for you to get the best out of your surgical procedure. If you see a surgeon and he is only lifting your skin, he's not treating your face, you're going to need a skin therapist, an esthetician, a medical clinic to look after your skin to help you get the best out of your surgery.
Okay, that makes sense. So, anyone listening that's trying to understand the direction of aesthetics, I guess what is the takeaway from this? Because we're not saying there is, well, you just summed it up really. It's about um, an approach that combines everything. You need to look at your overall skin health. You need to look at long-term skin health, and then look at individual procedures that are going to work for you.
Absolutely. And the field is moving away from creating volume, creating contour. Okay. The focus now is totally on improving skin quality.
Mm.
We do that by improving the skin biology, and therefore people's skin looks healthier, and therefore they age healthier. And we do this through modern approaches now. Resurfacing, that can be via lasers, erbium YAGs, CO2 lasers, fractional or fully ablative. Collagen stimulation, that could be through radio frequency microneedling, as well as injectable biostimulators. And tissue tightening, that's usually best through either laser resurfacing or some of those energy-based devices such as HIFU, uh, electromagnetic stimulation, and maybe ultrasound stimulation and deep radio frequency stimulation.
Yeah, so it's actually really important to understand the science behind it, isn't it? Because actually, the way you section those, I thought some of those actually fell under different umbrellas. So that's kind of clarified that for me. Um, I guess moving away from fillers is the future. We've talked about exosomes and that they actually could be the future as well. There's a lot of research going in there. What else do you see the future? What else you getting excited about?
I think the future is going to have a more of a focus on regenerative medicine. And what does that mean? That means using your own cells to regenerate tissue, repair tissue. So we're going to be using blood cells. We're going to be using PRP, plasma. We might be able to get simple ways of drawing the stem cells from fatty tissue. Um, so I think true regeneration is going to come. We're going to be using more energy-based devices, and we're going to be injecting less foreign bodies into our skin. And I think that's what's going to happen, and that will repair the aging process, which will naturally create some volume, improve skin thickness, and therefore when you combine that with the healthy wellness lifestyles people are leaving now, as well as, maybe they'll be emerging with longevity medicine, I think that's going to be the future. So aesthetic clinics are going to really have to incorporate dermatology, aesthetics, plastic surgery, skin estheticians, longevity medicine, and also GPs, general health as well.
Yeah. So when you go to a clinic and somebody's telling you that they've got one thing that's going to fix all, be highly suspicious.
Yes, exactly. But it can be difficult when someone says they've got 100 things to choose. What do I choose?
Yeah.
And I think that's the difficulty. A lot of patients are seeing on socials. What do I choose? What do I choose? So just a bit like, how do I choose a clinic? So you choose a clinic and let them choose the treatment with you, not for you, with you, based on what options they've got for you.
Okay, so we've talked a lot about what patients should have. If someone's got £2,000 to spend on their skin, I'm going to flip it around. What should they avoid?
First of all, they should not jump straight into the most trending treatment they see on their socials. Don't just jump all into one treatment, because I would say that not one treatment will fix all.
No. And
You want,
also do the research because, as I've said, sometimes it's marketing and a lot of the treatments are actually treatments that have been around for a long time where they've just been given a fancy new name.
so when someone has £2,000, Amber, find a clinic who you can discuss a treatment plan, focus on your skin health first, okay? And make sure you're involved in the treatment plan and they understand your goals and expectations.
Yeah, it's a very exciting time because, as I said in the introduction, really, I think there is so much available now that does actually deliver really amazing results. I think it's more important than ever to really understand what long-term treatment you're going to undergo because you can get such incredible results. Whereas I think maybe 10 years ago, that you could get incredible results, but they weren't as good as they are now.
And that's thankfully due to science,
Yeah.
science and evolution. And look, example, I've invested in a laser in the clinic, a pico laser. It's the third generation of this technology. And I tend to wait for second or third generations because the first two iron out all the issues and they perfect it. And
Yeah.
now we've got an amazing bit of kit that does amazing things. So yes, I'm always watching the technologies evolve, and I don't always jump on the first version. Yeah.
No. Okay, well, my last question really, 10 years' time, what do you think the industry is going to look like? I mean, you've touched on where the research is going. What do you think it will look like?
I think there'll be a great focus on regenerative medicine, treatments that will stimulate repair rather than simply add in volume, and then will be integration of skin health, wellness, and longevity medicine.
Amazing. Okay, thank you. I hope that's helped clear up a lot of areas for people. I know that I learned something from that. So thank you.
Thank you, everybody. And please like and subscribe us, and do share it with your friends. And we'll be sending out the next episode very soon.